So, I'm sorry that I couldn't make it to the demonstration today. I had to do a whole bunch of stuff around my house because we're going camping at the end of the week. But because I know a whole lot about healthcare policy, considering I've worked in healthcare policy for the past 14 years, I thought that I would give my 2 cents at least while I'm sitting here with my kitty in my lap instead of being out on the street with all of the people that are doing it. It's so awesome. Yay. It's something that needs done because what I've been kind of talking with my wife about all morning is this piece of healthcare legislation, the American Health Care Act that's coming out of the Senate, is more than dangerous for people that are young, people that are middle-aged, people that are not Medicare age, 65 and over. I mean, I haven't had health insurance under the Affordable Care Act since it started. My wife has, because we couldn't afford for the both of us to have insurance. So I'm not saying that the Affordable Care Act, Obamacare, is perfect, because it's not. But it's a lot better than this. My friends and family and neighbors that were able to get Medicaid to help treat their conditions like diabetes, depression, different mental health illnesses, addiction therapy, has been amazing. It's been a blessing. And so not having health insurance and having to pay a penalty for not having it has been fine for me. A, because I haven't had to pay a penalty because my work doesn't offer affordable insurance. In fact, they don't offer insurance at all because under the Affordable Care Act, companies with 50 employees or less were not required to offer their employees health insurance. So the surgeon that I work for decided that that was not a priority. Therefore, no health insurance for me working for a surgeon, if that makes any sense at all. But the American Health Care Act is a death sentence, not just for young people. I mean, young people may or may not suffer dropping off of Medicaid. Certain conditions like diabetes and mental health and addiction and cancer and other chronic and vital and fatal illnesses that they would need to have that vital coverage for, they won't have it anymore. So it'll go back to pre-2009 where people just went into the emergency room when they were going into ketoacidosis because their diabetes is so far out of control because they can't afford their insulin, or going into their doctor every 3 months to check their A1C. Why? Because those tests cost about $100, $120 for the visit and the blood work out of pocket. That is the difference between groceries and no groceries for most people that do rely on Medicaid coverage. So, I mean, ERs are going to lose money. You know what happens when people don't pay emergency room visits and it goes to collections? It goes on the back end of people who do have insurance to pay those dividends that were not paid by people that received services at emergency rooms. So in the end, cost of healthcare for people that are actually paying for it goes up. What happens then? People complain that their health insurance premiums and deductibles are too high. Okay, look whose fault that was. You didn't provide, with our tax dollars or with government subsidies, insurance for those who need it most. So then their primary care visits, which would have been much cheaper, $120 or so out of Medicaid's pocket, all of a sudden become thousands, tens of thousands in hospital visits. My mom just went in and had a coronary stent done, $56,000 that her insurance paid for. If she did not have insurance through work and something were to have happened to her and she would have had to drop on Medicaid the way my stepfather did when he had his stroke and his aneurysm, how much did Medicaid end up shelling out? Probably a damn near $100,000. If he wouldn't have been able to have that, he would have died. These are the things that are going to affect middle-class working people, okay? What people don't realize is that Medicaid, it primarily services older Americans, Medicare-aged Americans, 65 and up. Medicaid pays somewhere around 65% of all long-term health care for 65 and up individuals. That's our parents, our grandparents, people that are in memory care, people that are in long-term facilities. 65% of Medicaid goes to that. So what happens when those people lose that Medicaid coverage because they decide to slash it in 2021 according to the American Health Care Act? That means that people our age, in our 30s, 40s, and 50s are going to have to take our ailing parents and grandparents into our own homes or pay exorbitant amounts of the costs for long-term care facilities when we already can't afford to take care of our own health care because we can't afford insurance based on these corporate giants that control health care. Anthem Blue Cross Blue Shield, Pacific Care, United Healthcare, even the Kaiser Foundation and Kaiser Healthcare and Kaiser Permanente. They're giant corporations that control the cost of health insurance. It costs money to take care of people, but if you're not getting a tax reimbursement from the people that is, of course, funneled through the federal government, they can't afford to keep costs down because these things are so expensive. Why are these things so expensive? Because physicians and their costs and their negotiated rates are ridiculous. Who wants to pay $500 for 5 minutes of a physician's time? Not me. That's cash pay. They make agreements with these healthcare companies that say, no, I'm not going to pay your cash pay price to you for that time you spend with a patient that's covered by my insurance. We're going to negotiate $200, and the physicians can take it or leave it. If they decide to take it, then of course they get more patients because those patients are covered by that health insurance. So it's a win-win to accept more or accept less money than they would if the patient were just coming in paying cash in order to see all of these patients and be referred by these patients that have this particular insurance, whether it be United Healthcare, Blue Cross Blue Shield, whatever. So it's a vicious system, a vicious cycle, with greedy doctors that charge way too much money, greedy insurance companies that allow these physicians to charge this much money. Medicaid will pay $54 for the same exam that with a physician that United Healthcare will pay over $100 for. What's up with that? And for that exact same exam, it'd be over $200 for someone paying cash. There's a disconnect. There's some screwed up politics going on here, and it all revolves around money. And it all revolves around the fact that physicians are greedy, insurance companies are greedy, and people are uneducated. So we need to educate ourselves. We need to make sure that we hold our doctors accountable, our insurance companies accountable, and ourselves accountable for the fact that we don't understand this really difficult situation that we've been put in by our legislators. We have to hold them accountable to keep us educated. And even if they don't keep us educated, they need to have our best interest in mind, not people making over $100,000 a year getting huge tax credits for buying insurance from a private market. Oh, good job buying insurance from these insurance companies that pay my bills as a freaking health or as a representative. They're not representing the people. They're representing their special interests that line their damn pockets, the insurance companies and the doctors. And what's funny is the American Medical Association and AARP owns Secure Horizons, by the way, which is a Medicare replacement plan. So they are also an insurance company. Don't pretend like they're not. AARP profits from healthcare legislation. So they're just just an additional piece of the problem. The American Medical Association and other medical associations also profit from healthcare legislation. Don't pretend like they don't. But even when the people that would be profiting from this healthcare legislation are opposed to it, you know that there's a big problem. Thank you very much for listening to my rant. Now I can stop talking my wife's ear off about it. Have a wonderful day. Stay strong and resist over and over again. Keep resisting, because even though this might not all make sense, and I can't go into all of it all at once because it's so incredibly complicated, we need to be vigilant and we need to talk about it, because if we don't, it's our friends and families and neighbors and parents and grandparents that are the ones that are going to suffer. Thanks, guys. Have a good day.